viewers. Today the topic is the anatomy of the esophagus. The esophagus length is 25 centimeters in adults and it is 10 centimeters in children. And regarding the esophagus, we have to know about the constrictions of the esophagus. There are mainly 4 constrictions present. On the screen, you can appreciate the image by the first constriction, which is present at pharyngoesophageal junction at this point, and that is the upper esophageal sphincter is present here. And the second is the arch of aorta, at the arch of aorta, and the third one is at the left bronchus crossover, and the fourth one we have at lower esophageal sphincter, and this is the fourth one. So in total we have main 4 constrictions to remember. And another point which is mostly asked in the MCQs is the distance from the incisor teeth. So each of these constriction has its individual distance from the incisor teeth. The first, we have to remember 4 main numbers, that is 6, 9, 11 and 15. So the first one, distance of the upper esophageal sphincter from the incisor teeth is 6 inches, and the distance of the arch of aorta from the incisor teeth is 9 inches, and the distance of the third constriction from the upper incisor teeth is 11 inches, and the distance from incisor teeth up to the lower esophageal sphincter is 15 inches. So when we have to convert it into the centimeters, just you have to remember 1 inch is equal to 2.5 centimeters and multiply it with the same. So when you multiply with 2.5, you will be getting 15 centimeters and 22.5 centimeters and 27.5 centimeters, and the last 15 inch means 40 centimeters. So there is nothing to confuse in this also. And we have to remember 2 more important points regarding the upper esophageal sphincter and the lower esophageal sphincter. So what are the important points? The upper esophageal sphincter, it is mainly due to cricopharyngeus. So the most common perforation will occur at upper esophageal sphincter. So what is the most cause of this perforation is, it may be iatrogenic or instrumental. Because mostly during the upper endoscopic procedures, here we can appreciate the image that when the flexible endoscope is passed through the esophagus, it may damage the layers which is present on the inside the esophagus. So in this way, the most common perforation mostly takes place at upper esophageal sphincter. And what are the points regarding the lower esophageal sphincter? The lower esophageal sphincter is usually high-toned because it has a high-tone muscle. And what is the importance of this high-tone muscle is, the passage of food occurs in unidirectional method. So what happens if this high-tone muscle loses its tone? So when the tone is decreased, or when it loses the tone of the muscle in the lower esophageal sphincter, then the food may also travel in 2 ways. That is, usually the food passes in unidirectional, but when the lower esophageal sphincter is loose, and the food may also pass above. When the food moves in bidirectional method or in 2 directions, then it may lead to gastroesophageal reflux disease. The contents present in the stomach may also regurgitate into the esophagus. So these are the most important points regarding the anatomy of the esophagus. Mostly we are confined to the pathological concepts, and that's why these points you have to remember. We have to remember the distance and of the esophagus. It is mainly 10 centimeters in children and 25 centimeters in adults. And the next one, what is the distance from the incisor teeth? Each of the constrictions has its own distance, 6, 9, 11 and 15 inches. And you have to remember the importance of the upper esophageal sphincters and the lower esophageal sphincters. The upper esophageal sphincter has the most common perforation, and the most common perforation is due to iatrogenic or instrumental. And the lower esophageal sphincter has a high tone muscle, and due to this the food passes only in one direction, and when it loses the tone, it may lead to gastroesophageal reflux disease also. Thank you for watching.